Hey guys, welcome back to my channel. This video is all about my first workout post FAI hip surgery. So I had surgery on last Wednesday, which was June 13th, 2018, and today is Friday the 21st. So it's been a week and 2 days since my hip surgery. I will have kind of a playlist of all of my FAI related videos, but I thought today's would be really good to show you my first time into the gym post-surgery, doing some of the exercises my physical therapist has recommended. I did go to physical therapy for the first time yesterday, and so I kind of have some homework that I can do at my home gym. So I'm going to bring you guys along with me to see some of those exercises that you can start to do, of course, with clearance from your doctor, surgeon, and physical therapist a week and a half after surgery. But at this point, I'm feeling pretty good. I definitely have still a lot of soreness, especially in the incision area of my hip. I do have 2 incisions, so those are located, one right here and one almost on more of the side, that are covered right now with band-aids, but the first 2 days you do have a massive bandage on, so you are preventing a lot of the bumping that you might experience with, say, your crutches as you're getting used to them. But now I have only 2 small band-aids on under my spandex today for my workout. It's definitely interesting going to the gym for the first time post-surgery because as you'll see in some of my commentary, it's very interesting. Your mind kind of goes into like this autopilot mode of kind of how you used to get onto equipment or how you used to walk around the gym, and you have to constantly remind yourself that you are really starting from scratch and have to be very, very careful in your first 2 and 3 weeks post-surgery from FAI to make sure that that labrum is reattaching to the bone properly, that everything is healing, that you aren't doing any damage to the repair that you've just had done. And I definitely don't want to go through surgery again, so I have to be very careful of how I do things in the gym and also just listening to my body. So if an exercise or a position or a machine just does not feel comfortable, I need to just stop and either reset or just kind of skip that for the day, because my body is basically telling me, like, we just don't feel ready to do that. So I don't want to overdo anything. I don't want to cause more harm than good. So today's trip to the gym, I felt really good. I definitely noticed moments where things in my hip feel just a little awkward or uncomfortable. So I will make sure to tell my physical therapist that when we have our next appointment, which is on Tuesday, a couple days from now. So like I said, it's really important to just kind of get motion back into the hip, but I am still on crutches. So for the first 2 weeks, I am partial weight bearing. So that means I'm either using my walker or crutches, but I'm never walking freely throughout the house. I'm always kind of putting a lot of the weight in my arms, especially on the crutches and on the walker. So I'm still partial weight bearing for the next week or 2. So a week and a half out, how am I feeling? So I definitely still have a bit of swelling in and around the incision area. That's still very tender. I also have a lot of numbness still on like the side of my leg where, I guess nerves are just kind of still figuring out how to fire again, or maybe it's just kind of just nerves repairing. So I have noticed that almost like when you get Novocaine, when you get dental work done, you can kind of like have that weird almost like, you're touching your skin, but you really can't truly feel it. You just feel the pressure. That's kind of how I feel on my side. My rest of my leg feels completely fine, and I definitely still feel soreness on like the inside part of my hip, more like in that groin area where a lot of the work was done to both shave down some of the impingement bone and then reattach and repair my labrum. So definitely soreness, definitely still a bit of like numbness, some tingling, as like I said, those nerves are kind of like refiring. And otherwise, that's kind of the feelings that I have today. Some swelling, I do have a lack of appetite, but that's also because I'm on different medicines. So as far as medications are concerned, I am on Celebrex, which is an anti-inflammatory, twice a day, morning and evening. I am on a prophylactic care to prevent blood clots, 325 milligrams of aspirin once a day. I was given Valium to take the first couple of nights to prevent muscle spasms, which can happen after arthroscopic surgery on the hip. So that helped me to sleep a lot the first couple of nights. And then I do have pain medicine to use as needed for breakthrough pain, which has really just been more of, trying to help me get to sleep comfortably, or if I've done a little bit too much walking around and I really feel like very sore inside the hip joint, I can take it then. But otherwise, those are my medications. And yeah, a week and a half out, I'm feeling pretty good. I can't wait to get off of my crutches. I can't wait to drive again. I can't wait to really leave my apartment. But my husband's been fantastic. He's been a really great nurse. He as well has been through hip labrum surgery, so I kind of had a really good understanding of what to expect post-surgery. My dog has been absolutely fantastic. We did have her stay with family for the first couple of nights to prevent her from kind of like jumping on my incision. I was definitely really out of it from the anesthesia, and I didn't have the ability to pick her up like I have to a lot of the time. So now that she's home, I think she's super hyper aware of my injury because she knows where not to go. She hasn't left my side. She's been really, really sweet. So if you do have a pet, that's something to consider, depending how big or small they are, also how needy they are. My dog is a mommy's girl, so she is always with me, but she's been absolutely amazing throughout my recovery. But I did need her to be out of the apartment and away from me for the first couple of days to just kind of settle in and get everything situated in the apartment. So like I said, I'm going to show you guys some exercises. I'm also going to continue to post throughout my recovery and share my whole FAI kind of hip story. I'm also sharing a lot of this stuff on my blog, jerseygirltalk.com, which I will also link below, so you guys can kind of learn a little bit just about the recovery process, products I've bought, things I've done, and if you have any questions, feel free to throw those in the comments down below. I'd be happy to answer anything that you have related to FAI hip surgery, especially if you have an impingement, if you have a labrum tear. I had what they call a pincer bone impingement. So anything you guys have questions about, comments, suggestions, feedback, anything, throw it in the comments down below. Hey guys, so I'm actually going to head to the gym now. The very first time going to my home gym post-surgery. It is a week and a half after the actual operation, so I'm really just going to go and do some basic sitting bike to just keep my hip warm and active. I am allowed to do a couple of different exercises that have been approved by the physical therapist. So more like mobility and range of motion things, very simple, very basic. So I'll be doing that in the gym too. I'll show you guys what those look like, but I'm actually really excited to just physically get back into the gym, just kind of that routine that I've missed for so long. So I'll show you guys what I'm doing in the gym, and keep in mind this is all dependent on what your doctor has approved for you to do, as well as what the physical therapist is telling you that you can do. But I'm going to walk to the gym now with my crutches and show you guys what I'm going to do today in the gym. So exciting. So when getting onto equipment, it's really important to use all of your upper body strength so that you're not pushing through that hip and your heel. So getting on the bike, it's really important to just make sure you're putting all of the pressure on your left leg and upper body and not that right injured leg. And you want to make sure that that injured leg is not going higher than 90 degrees. So that's why I keep the bike seat really, really low, and also go really slow throughout these movements, because you don't want to exert yourself too much. You just want more of that motion and to make the hip warm for your exercises. So get yourself on the floor in a comfortable position, and I'm going to walk you through all of my exercises. Right now, I'm just extending my leg out to the side in about 20 degrees, nice and slow. And then I'm going to do some core workout here, just basic crunches, because as I mentioned, you really want your core to be very strong to take some of that exertion off of the hip in the beginning. Next, I'm going to raise the legs straight up to the ceiling. Again, very, very limited movement just to get your range of motion back. The next exercise, which is a little bit hard to see, is really just a little bit of the abductions here. So butterflying out my legs out a little bit just to get that range of motion back and a little bit of the flexibility. Next, I'm going to turn onto the side that has not been operated on to just do some basic leg lifts, holding my hip there in place to make sure that I'm not overexerting myself and only going up about 20 to 25% in the degrees. So the next exercise here is just small pulse movements to bring the hip muscles in while you're holding that 2-pound medicine ball right between your knees. You want to do it as much as you're comfortable, but this is going to help build up those hip flexor muscles again and just squeezing those legs in slightly. So you're going to see a different variation of that here. It's really very easy to do, and it's going to help to strengthen up those muscles right around the hip joint. And again, use the lowest possible medicine ball that you have available to you. The next exercise is one I was allowed to start doing the day of my surgery, and it's just basically calf pulses. So I'm just tapping my toes forward and back to just keep that blood flow going. The next thing we're going to do is just slight kickbacks about 10 degrees backwards using something stable to hold on to, and you're going to just do these slowly. You're going to do the same motion forward as well, again holding onto something that's going to allow you to keep your balance. And I do this forward and back about 10 reps for 3 or 4 sets. Next, we're going to turn to the side and do these slight leg raises out to the side. And again, not overextending yourself, just really getting that range of motion back into your hip joint. I'm just going to show you a different angle here of those same exercises. You can also use your crutch if you want as stability. Again, we're going to do these slight kickbacks, no more than 10 to 15 degrees, at least right now for my 1.5 week out of surgery. And then we're going to switch over to going forward again, nice and slow, really using your core to keep your stability. And again, the range of motion is slightly limited for the forward, backward, and side movements. But again, these are going to help build those muscles around the hip joint that has just gone through surgery, and showing you a side view of what those pulses look like. Hey guys, so I just finished all of my PT exercises and I did a little bit of the stationary bike. It's definitely weird to be in the gym because you mentally automatically go back to your routine about like how you get up from the floor and how you pick things up, and you have to remind yourself every single movement you make over the first couple of weeks can detriment your surgery. So you have to remind yourself you just came out of a massive operation and things are still healing. So when you're in the gym, you kind of go on autopilot. But yeah, I just did some basic bike, which was good to just keep the hip warm and moving. Had to adjust the seat multiple times to make sure I didn't go past that like 90-degree angle that I'm only allowed to do right now. Sitting was comfortable, sitting was fine, but definitely you could feel like the awkwardness inside the joint. A couple of PT exercises, which I showed you guys. Definitely one thing that you can do is continue to work out your core, because it's so important that your core and your abs are strong and your lower back is strong, because it will take some of the load off of your hip when you are doing some more challenging movements in PT. But otherwise, it was really nice to get in the gym today. I am going to definitely use ice later because this probably will make me feel a little sore, but it was really exciting to get back in the gym because I've missed it for so long. So bike will definitely be my new best friend. Being on the mat will be my new best friend. And my crutches are definitely not my new best friend. I cannot wait to get rid of those guys. So yeah, not my typical workout, but we'll get there. So just a couple tips when you guys do get back into the gym for the first time after your FAI surgery. Remember that things are not what they used to be in your body and that you are still really healing. So The biggest challenge is that you, especially if you're somebody like me who's in the gym all the time, you come in here and you're kind of like on autopilot. You can lift things and you bend certain ways and you get off of equipment in certain ways, and you have to now adapt to the fact that you really need to use different muscles to compensate and take the load off of the injured hip. So take it easy. If something does not feel good or does not feel comfortable, just stop, because the first couple of weeks are the most important part of your healing process. And I have to tell myself that all the time. It's like, even though I'm fit and healthy, your body needs time to heal. So give itself the time it needs and just take it day to day. And even just physically coming into the gym is good, because you'll get back into your routine, which I have missed so very much. So things are going to feel uncomfortable. You're going to be very in tune on what hurts and what feels awkward, but listen to your body, because you don't want to push yourself too much and actually kind of like undo all of the hard work you've done with recovery after the surgery. So even a week and a half post-op, I know that there's a lot of room to grow, and there's still a lot of strength I need to develop, and mobility and flexibility in my hip, but so far everything feels really good. And hopefully these exercises will help you guys and also give you just kind of some inspiration that it's not going to take forever to get back into the gym and get back to working out, but you do need to take time and be patient. I also just wanted to show you guys really quickly the area of where my incision is. So I have 2 small band-aids on the areas where they did the orthoscopic instruments. Again, they're mostly in the front and on the side. And this is kind of that area where my incisions are and most of my discomfort. Now that we're home and we're finished, we're going to get our ice cube ready to go. So filling it up with water to that #1 level line. And a really cool quick tip, instead of loading this thing up completely with ice, I like to freeze 4 water bottles to kind of keep everything nice and cool. And then I will load up to the top line with just regular ice to keep this nice and cold for quite a few hours. And this is kind of what the machine looks like. I will add the lid on top, and I keep this right next to the couch that I'm sitting on. I lock that in nice and secure, and then after that I'm just going to plug the ice machine in. It doesn't make a whole lot of noise, it's actually pretty quiet, and then at that point it keeps everything nice and cool, and the water will start rushing through to the pad, which will keep it nice and cold for my recovery. Okay guys, so now that my workout is done, I've taken my dog for a walk. That's kind of like the extent of my physical activity for the day. So now is when I'll go take a shower, and I will kind of like get myself posted up on the couch to just kind of relax and rest and let my body recover. And that's when I'll do a lot of my icing. So I use a ice cube, and I do that multiple times a day for a couple of hours, and that really helps to reduce the swelling. It really helps to just make my incision site feel a lot better. That still right now has stitches, so I always have to make sure that I have a band-aid on those, that I have something between my skin and the ice pad, and I do that multiple times throughout the day. Like I said, it makes it feel really good. It also helps after PT and after working out, after stretching. So I'm going to show you guys really quickly kind of just how I put the pad on, and that's something that I highly recommend, either if your doctor doesn't give an ice machine to you or your insurance doesn't cover it. I will link below where you can get one on Amazon. Sometimes insurance will cover some of it or none of it. Mine in particular didn't cover any of it, so I had to pay out of pocket a $100 fee to rent the ice machine for 3 weeks, but it's totally worth it. And then there's also the option to buy it for like $185, which I probably should have done because it's just so worth it and I really like it. So I'll show you guys how I put it on. So the ice machine is the cube, and that is connected to kind of like this piping, and then the actual leg pad for the hip. So it looks like this, and it's attached right here, which was just kind of like a snap-on attachment. This side is the side that gets cold, and then this side is almost like a felt material, which is what you'll see the Velcro will stick to keep it really nice and tight and in place. So for me, what I like to do is kind of use the larger piece for the front of the hip, and then for the smaller piece, it kind of wraps around nicely on the side of the hip. And my incisions, just as a reminder, are both right here. So usually I'll make sure I'm wearing a pair of pants. I will lay that in a nice position there and kind of like wrap it underneath. And that's the spot where I'll usually do my icing. So what you will also get are these Velcro attachments, which help to keep the pad in place. So there's a short one, and then there is a longer one, and you could even, sometimes I'll do this, is just kind of like stick them to each other and make one really long one. All depends kind of the positioning that you want for your ice pad. So then what I will usually do is just kind of like wrap this around and use that Velcro to attach to the pad and get that nicely secure in place with one. Then with the longer one, I will usually kind of stick that to the top and wrap that again around and underneath. But this helps to kind of like keep the top part close to your skin. So I will kind of like keep moving that around and then Velcro it like so. Maybe I will slide it up or down, but that's kind of how it looks. And it stays cold for a really long time. And yeah, so that's kind of my padding and icing. So like I said, icing is really key to keep that swelling down. It also really just makes your hip feel good as you're going through your recovery. I will sometimes keep this on for 2 or 3 hours, just kind of while I'm watching TV, and then I'll take it off and give it a rest. But I have been using the icing a lot in the last week and a half since my surgery, and that's kind of like how it looks. It wraps around the hip really nicely. And again, make sure you are never letting the pad touch your bare skin. Make sure you're always having some kind of layer of clothing or even a towel, and you'll still feel it through that layer. But again, it's really important, and right now it feels amazing because I've done a lot today. But yeah, make sure that icing is a really big part of your rehabilitation. So here's a quick look at the area we are icing, right around the incision site and that side of the leg that is still very tender. And I'm also going to show you guys my 2 battle wounds. So I have 2 sets of incisions which are still being held together with sutures that will have to get removed by the doctor in my post-op appointment on Tuesday. But they're healing really nicely. They are a little swollen, but overall, I think they're gonna look really great when this is all done. Well, I hope this video was really helpful for you guys. I'm really sorry if any of you are going through FAI surgery, or you're considering it, or you're in pain and you're not sure if you need FAI surgery, but I will tell you that a week and a half out, I am feeling really good. Your first week kind of sucks. Definitely not going to sugarcoat that. Your first 36 to like 72 hours really sucks, and you're gonna need a lot of help those first 2 or 3 days. But like I said, I'm a week and a half out and feeling pretty good. More frustration and soreness than anything, and really looking forward to getting back into my normal fitness routine. Thank you guys so much for watching. Like I said, make sure to throw your comments or questions down below. Like if you found this video to be helpful, and subscribe for more videos coming to my channel very soon. Thanks for watching. Have a good one.